Hi everyone, this is my first YouTube video and I've been contemplating doing this for a while. I have my purse on. This might be a little clunky at first because I'm just doing this for the first time, and like I said, I've been contemplating it for a while. There's been a lot going on in my life for a while, but recently I had a health issue to come up, which is a relatively rare health issue. I don't do anything normally. I don't get anything normal. Well, I do, but I get these things that are just out of the blue. Just out of the blue. So every accident that I've had, anything that happens to me is just kind of always a little strange. But anyway, I'm going to try to keep to the subject. I am a behind the scenes person. I worked in video production for 17 years, and I can count on one hand how many times I appeared in video, and only one of those times was actually a facial appearance. The other appearance was a voiceover. They needed someone that sounded like a hillbilly a little bit, or had a mountain Appalachian accent, to play a dispatcher. And yeah, I kind of filled the bill on that one. But otherwise, I'm not comfortable in front of the camera. I will write all day long. In fact, I've done some blogging in my life, and not very seriously, but recently things have come so fast and furious in my life that journaling has been hard to find the time to do. Even the fact that I'm semi-retired has been hard. So the thought of vlogging and putting some of my thoughts out there, for my own personal benefit, to get things off my chest, and also, to help other people. Because in this case, when you come across a health condition that is so rare, and right now, I just, looking on YouTube, there are good medical things about what I have, but just experiences not a lot of people share. I mean, we're such a small subset of the population that have this disease, that a lot of people, it's just the ratio of people sharing about it online is a way lower than, say, MS or celiac, the bigger autoimmune diseases that people get, that hit a bigger cross-section of the population. And I am talking about an autoimmune disease. This all started about, I guess, I want to say mid-22, I'm pretty sure. I was going through a great amount of stress in my life. My now late husband was in the throes of his cancer battle. Even though things, well, I'm going to say it actually probably happened in 21, because that's when he was in the throes of his cancer battle. I'm sorry, my brain is a little fried on timeline because so much has happened in my family in the last few years. So let's say mid 21. I had gone to the doctor earlier in the year, just to get some medicinal help for dealing with some anxiety and stress. Of course, again, my now late husband was fighting cancer, very serious cancer, and I was also working full-time, trying to take care of him, trying to be upbeat for him, to be his encouraging person, trying not to show my emotions, my sad or fear or any other negative emotion around him, even though it happened some. I mean, it was just natural for both of us to have bad days. But for the most part, I felt like it was my duty to just be his cheerleader. And I still believe that to this day. But still, it takes a personal toll on you. And so there I was, and I was having a hard time sleeping. I was dealing with a great deal of anxiety, which has been an ongoing thing in my life for many years. And I'm not a medication person per se, but I'm not an anti-medication person either. A lot of people, you know, I think there's a time and place for medication. Let's just say that. I tend to want to go the natural route, and I'll get to my natural route in a moment. But, you know, there is a time and a place where you've done everything you can do personally in your lifestyle and in eating, you know, again, lifestyle, that you can, and things still are progressing not in the right direction, which is what I came up against. So fast forward, when I went in for the anxiety component, and I did get on a very low dose of antidepressant, which was supposed to help with anxiety, and it did. It really took the edge off to where I could sleep, to where I could function, and not feel this, like my insides were quivering all day long. Also, you know, I don't want to go too far down that rabbit hole, but also, you know, I did things to try to help with my anxiety in a natural way, in a self-care way, which helped also. So I go in, the doctor, you know, gave me the anti-anxiety medication, the depression medication, but he said, I want to see you back for a physical. You haven't had a full physical since 2016. And this was a new doctor. My previous doctor had moved on to another place, but I just never replaced her, because when I was working, we had like little mini physicals every year. They had a very good care plan where I worked. Little mini physicals that did a basic panel. It wasn't a full comprehensive blood work panel, you know, and everything would come back fine. My cholesterol would be a little high. It always has. And then, you know, I just kind of put off going for a physical, because I've kind of felt like I felt fine and everything was great. But then when I said, yeah, it's time for me to have a full physical, I was 50 years old. It was time for me to start doing that every year. Should have been doing it before. Well, on the lab work, everything came back fine except my cholesterol. And I did start on a statin for that. But also my liver functions were elevated. Well, by this time, my you know, my husband's disease had started to progress. I just was like, let's watch it and see. And the doctor agreed. He said, given what you're going through, let's just watch and see. So the next year I'll go back, they're elevated again, even more. Mostly my alkaline phosphatase, that was the one that was markedly elevated. My AST and my ALT were mildly elevated, still are just mildly elevated, ALT being the highest. He recommended that I go see a gastroenterologist, which most gastroenterologists do deal with the liver. There are liver specialists that are usually gastroenterologists first. That's what they specialize in, and then they subspecialize in liver for the most part. I could be wrong, but from what I've gathered, that's how it goes. Then I went to see the gastroenterologist, and he was fine. And I'm not gonna mention his name. He was fine. I think he was having an off day when he saw me. He seemed very tired. Blessed doctors, really blessed doctors. And you know, he kind of thought, well, you've probably just got fatty liver disease. He looked at, you know, a middle-aged woman, a little overweight, and just automatically just lumped me into the fatty liver disease. But he said, I'm going to run some more blood work just to see some different immune markers, and I want you to have a liver ultrasound. I was like, okay. So I did both of those. Liver ultrasound at the time did show a little bit of fatty liver disease, but showed some fibrosis. My immune markers came back for positive ANA, ASMA, which are the kind of red flag markers for autoimmune hepatitis. I was negative for AMA, which would have pointed more to a condition they call primary biliary cirrhosis, which means your bile ducts are inflamed, and usually it means the bile is kind of sludgy and it's not working its way through, and that's what's causing the inflammation, autoimmune mediated. So I kind of, and usually that's what causes the higher alkaline phosphatase. But then I still was having some I just wasn't typical for anything. So the gastroenterologist, instead of calling me, which I know they do everything through the portal now, I know that, it wasn't a surprise for him to come back and say, everything is still a little bit murky with you. We want you to have a liver biopsy. What he didn't know, and this goes back through the trauma I've been through, with losing my husband. A week and a half before he died, we knew my husband had some studies. I can't remember if it was a CT or if it was MRI. I think it was MRI. Some follow-up studies, which had shown the cancer was in his liver. So within a week, they wanted to schedule him for a liver biopsy. This was in late February 22. So without going into the whole story of that, he went in for the liver biopsy. He was never the same after that. Within a week and a half, he passed. So even though I knew it was completely irrational, there was a PTSD element, because this was like maybe July, and my husband had passed in March of 22. There was a PTSD element, and I was just like, I can't do this. And also, I had lost my brother in May. That's a whole story I may go into later. And then my dad had to have emergency surgery. I think this all happened before my dad's emergency surgery, but my dad wasn't doing well. His health was starting to fail. And because of the PTSD element for a liver biopsy, because I felt fine, I didn't feel bad. Maybe a little fatigue every once in a while, but good grief, everything I had been through, I should have been feeling fatigue, and I was. So this is how your mind works when you're in grief, and you've just been traumatized by a lot of things in the recent years. I'd had just a small window of about 3 years of just pure bliss with my husband in our relationship. But, we didn't even get a year into our marriage before he was diagnosed with cancer. And I knew it was going to be very serious. It wasn't going to be your usual prostate cancer, go a little radiation, will be fine. I knew from the get-go. I know just enough about medicine to scare myself, but also to be realistic about what was found. Sometimes it's just more than you can take. It's like, okay, something's going on with my liver, but no, I'm not going through this right now. It's just more than I can handle. So I went through 22, and got through that horrifically hard year with loss. My dad's health was failing, and by the fall, I just had this impression, and I've had impressions about 3 times in my life about very, very serious things, that my dad was in the last year of his life. I pretty well knew that. Without all the facts, but with enough facts that I could determine that my dad was going downhill. And he would make little strides, but then he would go back down and go down further. So I went through 22, went through 23. My dad's condition got increasingly worse, to the point that in March of 23 he started having hospitalizations frequently. Did some time in rehab, but he had a blood disorder. It was taking him fast, and his condition was also autoimmune. It wasn't cancer per se. It usually ends up in cancer. His never did. He died of the actual autoimmune disease called myelodysplastic disorder, which is another very rare disorder. His mother had died of it, even though it's not supposed to be genetic. There's always, they'll say it's not genetic, but then they'll turn around and say, oh, but there's a genetic correlation if you're carrying a gene for that disease. Go into all that in another video. But just basically, he was dying. I knew it. I was still trying to be a cheerleader for him and my mom. My mom didn't want to accept the fact that he was dying. Someday she would, someday she wouldn't. But anyway, I ended up being one of his primary caregivers for the last 6 weeks of his life. It was an honor. As much as I had dreaded it for months, could I handle it? Could I handle it? Caring for my dad throughout his hospice journey was difficult, I won't lie. But it was an honor. And it gave me a sense of purpose like I hadn't had since Ron had died. Anyway, and in addition to all that, I'm helping with Ron's estate process. I'm helping his son with that. A lot of paperwork. I mean, I retired the day before we put Ron in hospital. I retired. That was interesting too. But in the hospital and then hospice. So I've almost been semi-retired for 2 years now. It was a great decision. At the time, I almost went back after he died. The opportunity was there and I didn't, because God just said, no, you're done there. You're supposed to be where you're at right now. There's a reason. And the reason was I was going to go through another 1.5 years of really difficult. And so the Lord knew I needed that space in my life, even though there wasn't a lot of space for me. But anyway, that was his assignment for me, and still is his assignment for me as of this day. So with all that said, I want to get back to the autoimmune hepatitis situation. I really believe a lot of this was brought on stress. Fast forward to just a week ago. Well, fast forward to January. I decided to go in for a physical, really knowing that things were probably worse or no different. And as far as my blood work, and true enough, everything's a little worse, just a little bit. And so I asked to see a liver specialist. I wanted to see someone who just didn't do a little side hustle in their practice for liver, because I wanted to see a liver specialist. And thankfully there's one in the group that I see that's in my PPO. From everything I read, seems like the best in Charlotte, honestly. So thankfully he's in my PPO. And I couldn't see him. Excuse me, my nose is itching. I couldn't see him because he does a lot of procedures. But he doesn't see new patients. He accepts new patients, but they have to first see his nurse practitioner. And so in mid-January, I saw his nurse practitioner, and she was wonderful. She talked to me for 35 minutes. She was not in a rush. I probably asked her a lot of dumb questions, but she didn't treat me like I was dumb. Her and I had a lot in common in a lot of ways. So, we both deal with anxiety. She admitted that before I admitted it myself. So there was a lot. We just connected, and I still haven't seen the doctor, but she admitted that it really was time for me to either have, if I didn't want to have a liver biopsy, that I could do what they call a ECP, basically an MRI of your liver and your biliary system that specializes in finding inflammation and fibrosis, or I could move ahead with the biopsy. And by now, in late December, I had decided if things weren't better, I was going to move ahead with it. I was tired of not knowing what this was, and I was tired of sitting around not treating it. Go back to 23, the beginning, this time last year, I was so into wanting to do things naturally, which I do not judge anybody who do. I want to do things naturally. I don't want to be on medication. That I decided to see a functional medicine doctor. And I'm glad I did. Dr. B is great. Love him. I got so much benefit out of that experience. Tons of blood work, other studies, all came out of my pocket. Thank my wonderful late husband for leaving me in such a good place to where I could freely, without a lot of hesitation, do that. Even though I don't like spending that amount of money on myself, I knew I needed to be here for other people. You know, at the time my dad was sick. My mother's still alive. I still need to be here for her. I'm her only living relative, her only living child, not her only living relative. She's got brothers and sisters, but they're getting elderly too. So anyway, the whole, caring for your elderly parent thing. So I saw Dr. B and he was wonderful. And again, I got a lot of studies, learned a lot about my physiology, and it was all wonderful. Went on a specific diet for 12 weeks. It was tough. I had to cut out gluten and dairy. The gluten was the hardest. Dairy wasn't so hard because I'm not a huge dairy person, but there were things I missed. I miss cheese. I don't drink milk, but I miss cheese. So I got great results from that. I didn't lose a ton of weight, but that wasn't my goal. I'm still very much 30 pounds lighter than I was at my heaviest. But I had gained some weight, and then I had lost some weight after Ron died, just from grief. So that wasn't really my main goal, but I still need to be lighter. Don't get me wrong. Still like me sweet. I still like sweets. I'm a sweet person. But I got a lot of benefit out of that, and I did see a lot of physiological changes in my body via lab work and just how I felt. I think that really helped me get through that year, even though I couldn't always do it perfectly. And I'm going to do a whole video later about orthorexia. I don't think I was ever there, but I was, kind of on that line to where I felt like I couldn't eat anything, that everything was harmful. It's a mental condition a lot of people get in with trying to be natural and be clean eaters and everything. But sometimes, I know very, very strict eating, unless you have a disorder like celiac disease or something similar to where you can't eat a certain food because you'll die or you're going to be very sick the rest of your life and shorten your life. Eating that way is not very realistic. Let's just say that. But I'm going to do a whole video on that later on down the road. But getting back to that, everything changed for the better, except my liver enzymes kept getting worse. So I knew if it was my eating that was causing leaky gut and it was causing my liver to react, that was a good change to try to make, and I did. Well, let's fast forward to this month. Again, January. Again, I decided to move ahead with liver biopsy. That happened last week. And let me tell you, I read a lot of horror stories online about liver biopsy. I had my own experience. Ron's experience wasn't positive, but Ron's liver was very, very sick when he had his. People react to pain differently. I'm pretty tough. I don't mind needles. I haven't since I was a small child. I was weird that way. That's what I was telling the ladies doing nurses the other day when they were putting lines in and they couldn't get a line and they were like, oh, I said, listen, don't worry about it. I'm the least amount of chicken about a needle anybody you'll meet. But, I read on YouTube, read some things online, you're going to have level 10 pain. It's going to shoot to your shoulder. Ron had some of that, so I had lived that vicariously through him. But, oh my gosh, it really was nothing. It was a whole lot of anxiety about nothing for me. And again, that was just my experience. They gave me good drugs. They numbed me up. The next day, it only felt, once the numbing went off, it only felt like I had when you pull a muscle in your side. That was it. It was little tiny holes, like now, even a week later, I can't even see them. I mean, they take out just little millimeters of your liver. The biggest thing is you have to stay after procedure for about 3 to 4 hours. It ended up being about 3 for me, just to make sure you don't bleed, because the liver is a very, very vascular organ, and it can bleed very easily. But it was nothing. And so I'm down to 25 minutes on this video, and if you've hung in here this long, I'm sorry. This is my first video, so I feel like I got a lot to convey. But to get back to the autoimmune hepatitis, my path report came back, and because I was a medical transcriptionist for 17 years, I can read these things pretty well. I did have to look a few little words up just to know exactly what they meant. But it turns out I do have mild autoimmune hepatitis. Not, mild. The biopsy showed I did not have fatty liver, at least in the area that biopsy. I probably do have some. Most Americans do. But at least in that area, it didn't show any steatosis, which means fat in your liver. But then it did show mild autoimmune hepatitis. My bile ducts were inflamed, but there was no cholestasis, which in layman terms mean that my bile is moving through, so I don't have the PBC. But what was interesting was that it showed a possible drug-induced element. I don't take that many medications. I was taking only when this started, and I don't know when this started because I didn't have blood work full panel between 2016 and 2021. So it could have started any time between that. My liver enzymes in 2016 were perfectly low normal. Anyway, and then so something has triggered. They're calling it a drug-mediated autoimmune hepatitis. Now again, I haven't seen my liver specialist. I'll be seeing him next Tuesday, and I will come back with a follow-up. But part of me, and let me give a disclaimer here, I am not an anti-vaxxer. I think vaccinations serve an important purpose. But I'm also, let's not get crazy. Ron and I, in 2020, and by the time we were eligible for vaccinations, it was 2021, and we already knew he had cancer, elected for his safety, because he was going to be at doctor's offices, he was going to be having procedures, didn't start chemotherapy till late 2022, but we elected to do the COVID vaccine. Please don't judge. I don't judge anybody who says they did or did not have it. It's a personal choice, and I think it should be a freedom. Honestly, I don't think it should be mandated, ever. But we have cured a lot of diseases with vaccines that are pretty much gone, like polio, smallpox, things that used to kill hundreds and thousands and millions of people, we cured with vaccines. So there's a point. So, but I watched a seminar by the JHEP, which is the Journal of Hepatology, yesterday, saying there are some people who had autoimmune hepatitis to develop after taking the COVID vaccine. Very small number, but it is documented, several cases. And so now in the back of my head, I'm wondering, because the medications I were on at the time, which was, okay, let's say an antihistamine and a very, very small dose of antidepressant, none of which should have triggered a drug-induced hepatitis. I'm not saying that didn't happen, because everybody's chemistry is different. Everybody's chemistry is different. Everything passes through your liver. Everything you put in your mouth, every drug you take, every supplement you take, that's another whole thing about supplements. Anything you put on your skin, anything you breathe in, your liver is your detox organ. It is your filter. It is your blood's filter. So you might be able, somebody else might be able to handle what you're on, never show a liver problem. But me, it may just set my liver on fire. that's could have what happened. So I'm not sitting here blaming, and it's probably going to be a rule out thing. And he may even say, oh, I don't really believe you have DILI. They call it drug induced liver injury, but it just makes sure it kind of just throws you into autoimmune. So probably had the disposition, given my genetic history that I know of now. I may just have the tendency to develop autoimmune, and there's hundreds of different triggers for it. So one thing that the nurse practitioner told me, and I'm going to wrap up with this, talked to her for 35 minutes, and she looked me in the eye, she grabbed my hands, and she said, Vicki, you didn't cause this. This is not your fault. And, the good news is that 70 to 80 people go into remission. Very few people ever make it to the point with this disease, this autoimmune disease, that they have to get a liver transplant. So I'm very hopeful, no matter whether this is drug-induced, vaccination-induced, leaky gut, whatever, which I really don't think is leaky gut anymore, that I'm going to be able to go into remission. I've had a lot of negative things happen to me in the last, let's say, decade of my life, a little over a decade. A lot of worst case scenarios happened to me. And that's something I'm having to deal with in my own faith and in my own psyche. But through all this, I've become a way more optimistic person. Yes, I've had a lot of worst case scenarios, but a lot of my fears and anxieties have also not come true. I'm still here. God is taking care of me. I know He loves me. I have faith. And if I have a fast-moving form of this, so be it. To live as Christ and to die as gain. That is my outlook on life. No, sometimes getting to death is not a pleasant experience, but I know God's going to be with me every step of the way, because He's been with me every step of the way through the worst days of my life. And I know no matter what I face in the future, God is there. So I'm going to stop this now because it's over 30 minutes, but hopefully I'm going to come back and do more. Again, I'm hesitant. I don't like putting my face out there. I don't want to talk about anybody in my, I don't want to talk about anybody or to people to misunderstand me or to try to, I know when you put things on YouTube, a lot of people get nasty comments. Okay, fine. I'm pretty tough at this point in my life. But please, I'm really putting this out there because so few people go through what I'm going through with my liver disease. And I just want to be another person out there to encourage and to share my journey and to try to give a positive spin. There may be days if I decide to continue video blogging that I'm going to cry, I'm going to have a bad day, that I just need to vent, but mostly I just want to be here as an encouragement to others who are going through the same thing. And this is not going to just all be about autoimmune hepatitis. If I continue doing this, I'm going to hit a lot of different topics because I feel like, God doesn't put you through things for it to be in a vacuum. And internet can be a bad place. YouTube can be a bad place. Facebook, any social media can be a bad place, but I want to use it for good. And I want to use it as a ministry to others. So I hope y'all have a good day. I am not an editor, so this is going to be raw. But I hope y'all have a good day. And I hope that this has encouraged you or given you some insight in some way. Y'all take care. Bye.